with another class. In this, we are just going to see in brief the programs undertaken by the government for health purposes. And in this, we have the National Health Mission. It has the rural as well as the urban counterpart, and the rural counterpart is known as the National Health Rural Mission, and the other one is the National Health Urban Mission. So under this, there are so many other programs which is undertaken by which is under the Ministry of Health and Family Welfare. So these programs keep cropping up. We just have a quick look at these. Now, talking about the Janani Suraksha Yojana, JSY, it is a safe motherhood intervention under National Rural Health Mission. Its objective is to reduce maternal and neonatal mortality by promoting institutional delivery amongst the poor pregnant women. Then we also have the other one, that is Pradhan Mantri Swasth Suraksha Yojana. It was launched with the objective of correcting regional imbalances in the availability of affordable and reliable tertiary health care services. This scheme aims to expand facilities for quality medical education in the country. So this is to be done through establishing aims like institutions and upgrading existing medical colleges. So what is AIMS? All India Institute of Medical Sciences, where research as well as the research takes place, as well as we have a hospital which goes on. Then we have Ayushman Bharat program. So in this, there are two components of this program. One is the Health and Wellness Center. Under this, 1.5 lakh centers will bring healthcare system closer to the homes of people. So Health and Wellness Centers. And the next is National Health Protection Scheme. This scheme under Ayushman Bharat is National Health Protection Scheme. It will cover 10 crore poor people and vulnerable families. 50 crores beneficiaries approximately, and it will provide coverage up to 5 lakh per family per year for secondary and tertiary sector hospitalization. The schemes are good if you see, but the only problem is that implementation. How far do they go? So then you have the Swachh Bharat Abhiyan. It was launched in 2014. Main objective is to fulfill Mahatma Gandhi's dream of a clean and hygiene India, and it aims at a universal sanitation coverage and elimination of open defecation by a certain date. It was 2019, though it has not really happened. So the results of the missions are commendable, of course. The number of persons defecating in open in rural areas has declined to some extent. We really don't know. They do give a lot of statistics, but we don't really know how far it is true. So I'm not going to give it here. Then 8 states and 2 union territories, that is Sikkim, Himachal Pradesh, Kerala, Haryana, Uttarakhand, Chhattisgarh, Arunachal Pradesh, Gujarat, Daman and Diu and Chandigarh have been declared as open defecation free. So we also have what is known as Pradhan Mantri Ujjwala Yojana. That was in 2016. The main objective was to distribute free LPG connections to the women belonging to 5 crore below poverty level families across the country. So Pradhan Mantri Ujjwal Yojana will provide 5 crore LPG connections to the below poverty line families with a financial support of 1600 rupees 1600. Connections will be issued on the name of women beneficiaries. and EMI facility will also be provided for stove and refill cost. So, and in this there was also a campaign of Give It Up campaign, under which 75 lakh middle class and lower class households have voluntarily given up their cooking gas subsidy. So that was a give up campaign, and they were issued certificates. Then you have Mission Indradhanush. The main objective was to immunize all children as well as pregnant women against 7 vaccine preventable diseases. 7 vaccine preventable diseases, which is diphtheria, whooping cough, tetanus, polio, TB, tuberculosis, measles, and hepatitis B. That was target was 2020. And there have been some other health programs also, like for example, National Tuberculosis Program started way back in 1962. Then we had this National Leprosy Eradication Program 1983. Then you had the National Program for Control of Blindness 1976-77. We have the National Malaria Eradication Program way back, say, in 1958. So from time to time there have been some programs, health programs, which have been followed to bring about, to improve our social infrastructure, health. So we also have had the expansion of nutrition program, and in this it is this came up because it was found out that around 70 to 80% people do not get nourishing food. So they are getting food, but there's lack of nutritive elements like proteins, minerals, vitamins, etc. And this formulates the food intake of the weaker sections of the country. So nutrition expansion blocks have been set up in different states to provide nutritive food to students, industrial workers, women, etc. And the main functions are to find out the nutritive deficiency among the different sections of the population. Number 1, 2, to expand and publicly expansion and publicity of programs which are connected to nutrition. That is encouraged, and monitoring of the nutrition program. So nutritive food was given to children, or is being given to children under the midday meal program. That is, we also they've talked about special nutritive program. Under this scheme, nutritive food is given to about 229 lakh children, pregnant and breastfeeding women. Then there is this nutrition education. So even people are made aware of the importance of nutrition. So you can get a question as just mention, say, 2 or 3 government programs for health, and in this you can write it like this.